Hi, everyone. I'm Kara Sundlin. Thanks for joining us on this Facebook Live. Happy Valentine's Day. You know, it's a day where we think a lot about love. So if you really want to extend that kind of love to the people that you love in your family and even to yourself, we got to talk about taking good care of our mental health. And that's what this is all about. Community Health Resources, or CHR, is the most comprehensive nonprofit behavioral health care agency in our state. And CHR offers a wide range of services for children, families, and adults, many who might be struggling with anxiety or depression, touched by addiction or homelessness or trauma. We're joined now by one of the counselors there, a therapist, Patty Jarvis. Thanks so much for being with us, Patty.
Oh, thank you for having me today. Good morning.
Good morning. You know, and I want to encourage everyone, if you're on the feed and you have some questions about how to get help, absolutely ask. You know, mental health, that might be one of the positives, Patty, that came out of the pandemic. We're really talking about it, and I hope that's ending the stigma. But, you know, sometimes talking about it and then that next step of, A, do I need help, and B, where do I get it? I think that's where people get stuck. And that's one of the things you want to talk about today is you have a brand new location in East Hartford, and CHR is accepting new patients.
Yeah, exactly. We're a new mental health clinic. We service children from the ages of 4 all the way through adulthood, and we have immediate openings. So if you have a family member that's in crisis or needs, you can call us. We're at 474 School Street, and we can set up an immediate appointment for you.
I mean, really, people are being seen within 2 weeks, maybe even sooner, which I know a lot of folks who've reached out to me, friends, especially with teens. A lot of teens are in crisis. Oh, how do I get a therapist? Who do I go to? And then they make phone calls and they find out, you know, no one's seeing new patients, or there's a very long waiting list. So this new facility couldn't come at a better time. I mean, you really can take people soon.
Absolutely. Tuesday mornings at 11 o'clock, we have walk-in hours. So if someone needed an immediate intake, we have therapists ready at that time to screen them and do the intake on the spot. And then we also have immediate openings throughout the week.
Yeah.
So people can just call and schedule something.
We've talked a lot about the impact the pandemic has had on families. Specifically, let's talk about children and teens. Are you just seeing a lot more anxiety?
Yeah, what a really tough time for kiddos, right? They missed almost 2 years of school, or they were doing school remotely. They lost a lot of social supports. Let's face it, most of the fun things about school are seeing your friends and participating in activities. So our kids have lost a lot of that. And due to the pandemic and not being able to see each other, I think that we've had to relearn how to be face to face with people, how to get along socially, how to be able to communicate. Unfortunately, we lost a lot of that. So that's definitely something we're working hard at here at CHR.
And, you know, obviously kids are also marinating in whatever is going on in the household, and families have had a really tough time. There have been job losses, there's been death, there's been sickness. Would all of that fall under trauma? I know you're offering new trauma-related services, but I think people get confused about the T word, like what is trauma?
Right. So, you know, trauma in general is any type of loss that you experience. It doesn't have to be, you know, the most serious, saddest thing that has happened to you, but something that affects you in your daily functioning. We have several programs at CHR. One of the programs that I'm specifically certified in is called TFCBT, and it's a trauma focused cognitive behavioral therapy program. And we work with kids in terms of teaching them coping strategies and support, providing them with support, and giving them the voice to tell their trauma stories and the difficulties and the challenges that they've faced. Um, we also have another program called Match, which many of our therapists are trained in. Match is also specifically for children who deal with anxiety, depression, conduct difficulties, or trauma.
Yeah, okay. And there's lots of different matching. I mean, if that's one thing, people, if they haven't been to therapy yet, what should they expect? How do they know that they're going to find the right person for themselves?
Right. I think, that's a great question because the fit is the most important thing in the therapeutic relationship. The therapist, you have to feel comfortable with the therapist. As a therapist, our most important thing to do with our clients is build engagement. So we're providing that, warm, trusting environment that they can come in and share those, their challenging stories or things that are on their mind. So we work really hard to make people feel comfortable here. When they come in, they can expect an intake, and we work in conjunction with the family based on what the child's strengths are. And we build treatment plans, and we move forward from there. Much of our work is done in evidence-based treatment at this point.
hmm I know there are plenty of folks thinking, gosh, I wish I could do this, but I don't have the time or the money. Let's talk about money. There are services for those who can't afford, and you also take insurance?
Exactly. Exactly. We never turn anyone away who can't pay. We have sliding scale fees. We uh, accept all different kinds of insurances. We want people to come here and we want to help them.
So don't worry if you're thinking, I can't afford it. Don't worry about it. Make the phone call, see what care you need, and the rest will be taken care of.
Exactly. Yep.
There may be those who need medication or they're on medication. It might not be right for them. You also do all of the medication management.
We do offer medication management. However, at CHR, in order to receive medication, you need to be involved in therapy. We believe both of those things go hand in hand. So you see a therapist weekly or biweekly, and then your medication provider is needed.
Gotcha, right. And the whole idea that the science has shown that the pills and the skills together gives you the best outcome.
Right.
So there's some of this might be outpatient therapy where, again, just you're going to come in and out. And are there any other more intensive groups that you would want people to know about or consider?
CHR offers a lot of different types of groups and higher levels of care. Specifically in East Hartford, we cater to children, families, adults, and individual and group therapy. We don't offer higher levels of care.
Yeah.
It's a small clinic here,
Oh.
but we do have it in many of our other clinics that we can refer you to.
Yeah, I also want to talk about another barrier. For many of our viewers out there, English may not be their first language, and it's really, I'm sure, hard to open up if you don't have the words for it. You do offer Spanish-speaking services?
Yes, we have a bilingual clinician on the premises, and also our office staff is bilingual. So we're able to meet those clients where they're at in terms of needing to use a different language.
That's great. That's really great. Do you think, for parents out there who might be listening to this, or even teens, if they're out there and thinking, I don't know, maybe I can handle this on my own, or maybe I need therapy, what would you say to people to determining, like, hey, what's the threshold of you might need to see someone that could help you?
So I think the important thing, first of all, is for parents to notice if there are differences in their child's behavior. Are they not eating well, sleeping well? Are they not as interested in activities that they used to participate in? Are they isolating? Those types of behaviors can be assisted with therapy. But again, therapy can be for anyone who needs a non-judgmental, uh, you know, neutral person to speak to support them. And I think nowadays, as you said, following the pandemic, so many of us have so many questions about things we didn't have to think about before. And therapy can certainly help you with that.
Yeah, I'm a big proponent. I love therapy. I've had it many times at different points in my life. And some would say, okay, it wasn't medically necessary. I think it's a way to just understand yourself better and learn better skills. Let's talk about couples too. I know couples have been through a lot. Do you offer couple therapy? Because there might be a lot of adjustments going on where couples still love each other, but they're just not getting along, or they're having so many things they have to deal with right now that they could use some skills.
Sure. If there's there are couples that are interested, they would go through the same process. There's an identified client who does the intake, and then a treatment plan is made, and we move forward from there.
Great. So you don't need a referral. You don't need to ask your primary care, please refer me to CHR. Just give CHR a call, and someone there can help you determine what the best course is for you.
Exactly. So they're going to reach out. The number to call is 1-877-884-3571. And they're going to meet, they'll be greeted by our Triage Center, and the Triage Center will screen you and figure out which is the best location for the services that you need.
Yes, and that was just on the screen right now. I'll just want to shout out the website one more time, but you can visit chrhealth.org. You can also take a look at their Facebook page. I'm sure you'll probably find this conversation there as well, but it's facebook.com/Real Life Real Hope. 877-884-3571. Again, new center, taking new patients, guaranteed you're going to be seen within 2 weeks in East Hartford. And if you're just joining the feed, we're speaking with CHR, one of the largest mental health service providers in our state. And I know one of the things that you wanted to make sure of, everyone, is that if they're just joining now, you don't want people to be worried about the cost. This is something that whether you take insurance or there's a sliding scale, if you can't afford it, not being able to pay is not a reason to not get help for your mental health.
Exactly. Give us a call. We'd love to help you. There's lots of therapists here. We all enjoy what we do, and you know, we do this to help people. So give us a call and try out CHR.
Well, I want to thank you for your time right now. And for anyone who's listening, we know it's Valentine's Day. Patty Jarvis is here with me. She's one of the therapists at CHR. It's a good time to give some love to someone you're concerned about, or even some self-love, and take care of your mental health. So thank you, Patty, for being with us. And I hope those of you who are watching on Facebook Live, take a listen, share it with someone you love, and consider getting the help that you need. Again, all the information on your screen right now. You can call, you can go to Facebook, you can go to the website, visit the new center of CHR right in East Hartford. Patty, thank you so much for being with us.
Thank you for having me. Have a wonderful day.
You too.